Good afternoon, and welcome to today's podcast focused on digital transformation and lessons learned from our healthcare providers as they continue to fight COVID 19. We are joined on the podcast by VMware's healthcare industry strategy team, led by Chris Logan and accompanied by Jason Bray, Rob Marty, and Ed Deming. Gentlemen, welcome to the podcast.
Thank you.
Thanks for having us, Tim.
Well, it's fantastic to have you all on the podcast today. It's December 3rd. We've been living in the COVID 19 world for the past 8 or 9 months, and our healthcare providers have been dealing with the recent spike in COVID 19 cases across the nation. I'll start by asking how the COVID 19 pandemic is forcing dramatic IT transformation and the way that our healthcare providers are delivering care. Chris, do you have any thoughts?
Yeah, I sure do. And thanks, Tim. It's a great question. I mean, we've seen what COVID did in the beginning with a lot of uncertainty, a lot of healthcare systems trying to figure out how they're going to sustain and even just take care of the patients with the unknown and variables that COVID brought to the forefront. As time moved on, some of the big things that we saw from a VMware perspective where we helped our customers the most was really in a couple of different use cases, taking proportions or pieces of the staff and moving them into new work environments. So a lot of work from home had started to take place, looking at it from the lens of what we would call non-essential employees, but we know they're all essential employees in healthcare because billing is required to be done, coding is required to be done, but those could all be done from different locations. So really changing how people did their jobs on a day-to-day basis. Also, the advent of reaching patients where they needed their care most in a telehealth situation. So, actually bringing technology services into the patient's home or wherever they needed to be in their care delivery and their care journey. And then we've also seen a spike of this opportunity to change how healthcare is being delivered and focusing much more on a consumer based angle and really looking at it from the lens of healthcare demanding or driving new digital channels to reach customers where they are. So, not only on top of solving the problems for vaccination development, solving the problem for patient care, isolating where we can, and treating the virus where it is in place, we're seeing healthcare shift with how they're delivering services and meeting patients where they are in their care journey. So, big significant changes for healthcare, which has very much always been a siloed legacy-based type of infrastructure and architectures to being much more consumer focused, consumer first, and consumer friendly, looking at how applications are developed and leveraged to meet that patient where they are.